Kengan Ashura has been renewed for a third season coming in 2023. So today guys, continuing with our theme on medical bills, I'm going to be looking at one of the anime's greatest fights so far, Akoya vs Cosmo. So if you've ever wondered how much it costs to stitch up an eyeball, or the obscene price of getting an ambulance to the hospital, then you're in the right place. Let me know which anime you'd like me to break down in my next video, and to make sure that you don't miss out, why not subscribe to the channel? Otherwise, if you're ready, let's begin.
Imai Cosmo, 1秒後左に回避、右に回り込んで進路を塞いで。痛み止め効いてないじゃん。
So first up, I think we'll hold off the X-ray charges here because it looks like the animators have done all that already. But this is showing that Cosmo has two transverse fractures going across both the ulna and the radius. Now, had it just been the one bone, he might have gotten away with a cast alone, but as both are broken, it looks like he's going to need some plate and screw fixation. And I'd expect the charge to come up here at around $16,000. And to be honest, with the announcement of the net worth of each company, this sounds pretty minuscule. Oh, now this might look like a pretty benign kick, but I think you'd be surprised with the damage that could be done. Taking blows that either twist the knee, pull the knee too far forward, or conversely push it too far back, put you at risk at rupturing your cruciate ligaments, which stabilise your knees. Now, I blew my own cruciate ligament just by kicking a football, and I couldn't walk right for 4 to 5 months, so you can imagine what an injury like this might do. Fortunately, we can see that he's able to weight bear, which might mean he's gotten away with it. To really know if the cruciate ligaments are damaged, he's going to need to get an MRI, which comes in at a further $5,000. Okay, so luckily this is just an abrasion to the cheek, but it is dangerously close to the eye. I don't think we need to do anything at this stage, but I think it would be important to keep an eye on the bleeding and swelling around that eye, as it's not uncommon that fights are stopped prematurely for this reason. So he's got him in a triangle choke here, and this move sucks for a number of reasons. Firstly, you're basically getting your face squeezed into your opponent's groin and potentially their balls, which can't be nice. Interestingly enough, this is a common way of getting a staph infection or a fungal infection on your face. The second downside is your opponent's using your own arm to compress your own carotid artery and causing you to black out. Reassuringly, however, a blackout like this doesn't really need to go to hospital. Oh god, that is savage there from Akoya. He's somehow managed to tear through into Cosmo's forearm muscles. And I would guess that this is probably possible if you had a strong enough grip strength. I mean, I'd be worried about Cosmo's ability to use that hand after this, as it's those muscles that help you to manipulate your fingers. If the muscles are still intact, he's likely going to need some stitches for the lacerations, and depending on how many there are, you're looking at a cost between $250 and $500. Okay, good, we know that the tendons aren't damaged as he's able to flex his fingers, which is a good thing for him because it means that he doesn't need any urgent surgery and he keeps his medical bills low. Oh god, what the hell? He's taken a bite out of his opponent's thigh. Surely that's illegal in this sport. Now, I'm sure many of you might be worrying about the bite itself and the chunk of flesh that's been taken out of his thigh, but humans carry a whole lot of bad bacteria in their mouth as well, which can be very harmful. In fact, I advise any patients I treat who've sustained a human bite with broad spectrum antibiotics because there's high risk of these becoming infected. So sorry Cosmo, that's going to cost you another $100. Akoya, you might need a dental check. Oh god, he's actually chewing his flesh here too. I think Akoya might need a mental health check as well. But I think the commentator is right here too. It looks like he's bitten down to his artery as we see that blood splatter come out the wound. And in that region of the thigh, you'd be looking at damage to the femoral artery. Now, if they don't put pressure on that really quickly, you could be looking at death through blood loss within 5 minutes. So my advice would be to apply a tourniquet to the area and place heavy compression on the wound and get yourself to a vascular surgeon. And in the US, to repair a wound like this, you're looking at a cost of around $25,000. Hopefully the tournament has a doctor around. Oh god, and this is where the anime steps up its goriness with a thumb straight through the rib cage. Now, the way the ribs are set up, each one is separated by an intercostal space where we find an intercostal muscle, a nerve and a blood vessel. And at this stage it's difficult to know whether he's fractured a rib or if he's just torn through his intercostal muscle. All we really do know is that he's going to be in an incredible amount of pain. Now, we don't routinely get chest x-rays to look for rib fractures because there isn't really much we can do about them other than pain relief. So no x-ray charge yet for you, Cosmo. You might just need some strong pain relief. Oh god, so he's effectively plucking his intercostal nerve like it's a guitar. Now, your intercostal nerves are nerves that traverse your whole ribs. They come from your back all the way round the front. And what this means is that no matter where that nerve is damaged along its tract, you'll experience pain over the whole area it supplies. And people often describe this as an excruciating pain, comparing it to that of an electric shock shooting across the nerve, immobilizing them where they stand. Oh, and there goes Cosmo's first rib, and what a crack it is. Now, most people who've broken a rib know that they've done it. There's very few sounds in medicine that are that recognisable. My only worry here is he's snapped the ribs inwards, possibly penetrating the rib into the lung. So we really need to get a chest x-ray to make sure that he hasn't deflated his lungs, and that's going to come in at a cost of a further $200. Oh god, so he intends on breaking every one of Cosmo's ribs. Now, if he ends up doing this, Cosmo might end up with what's called a flail segment, which is where you get part of the chest wall which is totally detached from the rest of the ribs. And the danger with this is that it doesn't move with the rest of your chest wall, and so can compromise your ability to breathe. But also that punch there he gives him to wake him up kind of reminds me of a maneuver that we use during CPR called a precordial thump. Now, we use this thump because it's thought that it can help to reset the heart if it's gone into a funny rhythm. But it looks like in this case, Akoya's just using it to inflict further pain. Oh god, and there goes the second rib. And the pain seems so intense, it causes Cosmo to black out. But why does this happen? Is it something that we all have in our physiology? Well yes, intense pain like this is able to trigger your vagus nerve, and as a result, this sets off your parasympathetic nervous system. This causes your blood pressure and heart rate to drop, and as a result, you faint. Now, the threshold for activating the vagus nerve in this way varies from person to person, and is the reason why we don't all react the same way to pain. Gosh, going for the testicles to escape this mount. To be honest, I don't blame him. If I was in a position like this, I'd probably do anything to get out. But just imagine the amount of damage you could do if you got hold of them. I don't think there's any medical cost you could pay to get out of that one. Oh, very clever by Cosmo here. He's trying to break the arm by hyperextending the elbow. Now, you've got to remember that the elbow is a hinge joint, and so it only opens and closes. If you move it beyond that point, it will either dislocate or break. And yes, it does look like the adrenaline through being in a life or death scenario has kicked in, which is probably blocking some of his pain receptors, allowing Cosmo to continue fight despite his injuries. Oh god, and that kick there looks like it might have broken more of Cosmo's ribs on that left side. Now, some of us have what are called floating ribs, which are actually the easiest to break, because they're only attached on the one side of their length. Now, the danger with a broken rib on your left side is the chances of you doing damage to the underlying spleen, which can rupture and lead you to bleed to death. So we're going to need to get an urgent ultrasound scan, which comes in at a cost of around $500. Oh god, a kick directly to Akoya's eye, and it looks like it's red, bleeding, and he might have lost some of his vision. So he's going to need an urgent assessment with an ophthalmologist to ensure that he hasn't perforated his eyeball. But if it has, he's going to need urgent surgery, which is going to come in at a cost of around $45,000. And this might not even repair his vision. I thought eye gouging like this in martial arts was illegal. Surely Cosmo would be disqualified for this. Again, very clever here by Cosmo. That injury that he's done to Akoya's eye has now restricted what we call his visual field. And I like the way they've depicted visual fields here, as this is the same way that I would describe it to my patients. Interestingly, if you've suffered from visual loss for another reason other than direct trauma, say for example if you've had a bleed on the brain, then it can lead to a whole range of other visual field abnormalities, some of which are totally bizarre. Oh, getting slammed through concrete like this has got to hurt. Now you could probably take 1 or 2 slams like this due to the thickness of the back muscles in protecting the underlying bones. Beyond this, I think you're probably looking at fractures to the spinous processes of the vertebral column, and these are points that the muscles actually insert into. So if they do get fractured, it's unlikely that you'd be able to hold onto your opponent even if you tried. So we're going to need to get a CT scan of the vertebral column to make sure he doesn't have any of these fractures, and that's going to come in at a cost of a further $5,000. Nice! Again, Cosmo at the last moment has been able to go into what looks like a bullet time mode and get Akoya into a further neck choke. And it looks like this time that Akoya hasn't been quick enough to get his hand into that choke to help prevent a blackout. Now with such repeated chokes like this and excessive compression of your larynx, I would be worried about a laryngeal fracture, and you might be able to detect this by your patient having difficulty with either speaking or describing pain on swallowing. So, to investigate this, Akoya is going to need to see one of the ENT surgeons. They're going to need to perform a nasendoscopy as well as a possible CT scan. Now, just to get an appointment with one of the ENT doctors, you're looking at a charge of around $500. The nasendoscopy is going to be a further $250, and then finally, a CT scan is going to be about $5,000. Not to mention the further bills it might cost if he needs speech and language therapy. Gosh, that is brutal, taking repeated shots to what are already broken ribs. Now remember that your ribs are effectively armour protecting your underlying organs like your lungs and heart. And once you've lost your armour, your underlying organs are going to be exposed to the full force of those blows. Now in the lungs that can lead to bleeding, causing a hemothorax, and if your heart is injured that can also bleed, and you can bleed into the sac that surrounds the heart, leading to a pericardial effusion. Now, if this is big enough, it can actually restrict the heart's beat and can cause people to die. So we're going to need to get an ultrasound scan of the lungs as well as the heart, and this is probably going to come in at a cost of around $1,500. But that's not counting any treatment that he then might need. And so Cosmo is victorious here, and so we're going to need to call an ambulance to get Akoya out of there. And in America, you're looking at a charge of anywhere between $500 to $2,000. He's also possibly going to need a hospital inpatient stay because he's had a loss of consciousness. And per night, you're looking at around $12,000. Hopefully Akoya's got a big company behind him to pay some of these bills. Okay guys, that's all we have time for today. Let me know down below which medical bills surprised you the most. I have to say the most surprising one for me would be getting the ambulance. If it was that expensive, I think I'd just get an Uber or a bus. Anyway, if you've enjoyed today's video, why not watch one of these two videos where I've looked at medical bills in Dragonball Z and in the Bucky series. Otherwise, thanks for watching and I'll see you in the next one. Thanks.